Speaking of testing, for the last couple of weeks here on More or Less, we have been picking through the figures the government has released to say how many coronavirus tests they've been completing each day.
At the beginning of last month, at this podium, I set a goal that anyone who needs a test should get a test. And that as a nation, we should achieve 100,000 tests per day by the end of the month. I knew that it was an audacious goal, but we needed an audacious goal because testing is so important for getting Britain back on her feet. I can announce that we have met our goal. The number of tests yesterday, on the last day of April, was 122,347. This unprecedented expansion in British testing capability is an incredible achievement, but it is not my achievement. It is a national achievement, achieved by a huge team of people working together. And I'll tell you this, the testing capacity that we've built together will help every single person in this country. Testing is crucial to suppress the virus.
Our producer, Kate Lamble, has sort of become our testing correspondent. Hello, Kate.
Hi, Tim. It's that time of the week again.
Yes, the time of the week when you tell me that Health Secretary Matt Hancock has claimed that more than 100,000 tests were done in a day, before explaining that what Mr. Hancock has said is not true.
Look, I would love to say just yes, they did it and move on. It would give me much more time for gardening and less time checking government websites. But the numbers are still being presented in a confusing way, so it's worth going through it one more time. The government set this target of completing 100,000 tests a day by the 30th of April, and they made a big fuss about hitting the target on the 30th of April. And they say they've hit it again 6 times since, including 4 times during the past week. But as we said before, the numbers that the government is claiming include home testing kits, not when they're completed and returned, but on the day they're sent.
Yes, a swab in the post is not the same as a swab in the nostril, and not all of those tests will be completed and sent back.
No, one of our listeners told us that their kit was left in a puddle by the delivery driver, so they haven't been able to use it. And secondly, completing a home test is complicated. Our colleague Beth got sent one this week.
Let me just open this up.
To do a test, you have to book couriers, register the kit online, and handle the swab procedure itself.
Having read the instructions about how to take the test, I'm kind of dreading it. You've got to get the swab and you've got to get it to your tonsils without touching your tongue, teeth or gums. And then you put the same end of the same swab gently into your nostril. So basically you get a load of tonsil juice and then you shove it up your nose. It says on the instructions, this may be uncomfortable. Yeah, I think it probably will be.
It seems reasonable that the number of posted tests isn't the same as the number of postal tests actually done.
I haven't even played you the audio of Beth actually doing her test.
That is truly disgusting. That is not very nice at all.
She doesn't have coronavirus, by the way.
Good, I'm glad to hear it. Now, last week the government wasn't releasing figures on how many posted tests have been returned and completed correctly. Any progress on that?
No, they're still not publishing that information. And there's another source of confusion. The government is including all the tests carried out for research purposes by the Office for National Statistics and by universities. We mentioned this last week, but then it was at almost 4,000 tests a day. Now it's up to 30,000 tests a day, so it's a big source of distortion in the headline numbers.
But why do you say it's a source of distortion?
Because while these tests are potentially giving vital information about the prevalence of the disease, the Department of Health and Social Care say they aren't being used to diagnose cases. The government itself doesn't count people who receive these tests as people who've been tested. Nevertheless, these non-diagnostic tests are being added to the figures, and they're what's making it possible for the government to keep claiming that the target has been hit. Beth got sent her test as part of a research study, so this sound is the noise of a test being completed, but not a person being tested, which is a bit odd. If you remove the posted kits, because we don't know how many were actually carried out, and the research kits, because the government itself doesn't count those as people tested, then on the 15th of May, we go from the government's figure of 136,486 tests to only 69,900, which we know were actually carried out for diagnostic purposes. Using this, there have never been any days where the 100,000 target was met.
And what about the number of people tested? Because last week we were saying it looked like there was roughly a 2-to-1 ratio of tests to people tested.
It's not far off that this week either. Of the 69,900 tests we know were done on the 15th of May, they were done on 43,298 people.
So why is there such a big difference between the two figures?
Well, the Department of Health and Social Care say there are a number of clinical reasons why a person would be tested more than once. For more information, we approached Public Health England, and they gave us 3 reasons. Firstly, testing different samples from the same patient. For example, a throat sample and a sputum or saliva sample.
Now, it seems to me if you go to a drive-in centre and they stick a swab up your nose and ask you to spit in a tube, you're only being tested once, not twice. But judging from what Public Health England have told us, that might actually be counted as 2 tests.
Public Health England also say that repeating a test after it received inconclusive results and double-checking a negative result from someone who'd previously tested positive for the virus could also explain why there are so many more tests than people tested. To find out more, I talked to Mojisola Akinyele. She's a staff nurse at Hinchingbrook Hospital in Cambridgeshire, and she's just finished a deployment on the COVID wards there, where she's been carrying out a lot of testing.
So you think about you dipping a swab stick to the back of the throat of a patient. Now you might end up throwing up or, wanting to throw up. You're dealing with patients who have dementia. So in that case, when you've swabbed them, if they hit the stick and it falls on the floor, that's a contaminated sample. You would have to then restart again. There's just several factors that could affect that.
But really, Kate, common sense says that none of this should really count as 2 tests. I don't care how many different samples you have to try to test. As far as I'm concerned, you can't double or triple count tests that are done on a single person on a single day to find out a single piece of information, which is whether they're currently infected.
It's worth remembering, though, Tim, that over a longer period, there are perfectly valid reasons to go back and test the same person more than once. Here's Mojisola again.
There had been issues where patients had been tested initially because they thought that they had coronavirus and then they tested negative, but maybe a few weeks down the line, whilst they were on admission, then began to become symptomatic and had to be retested again just to rule out coronavirus.
Mojisola Akinyele, and before her, our own Kate Lamble. Earlier